Introduction. Electrocardiography, ECG, is a valuable diagnostic tool that provides insights into the electrical activity of the heart. In this comprehensive exploration, we delve into the purpose of ECG, the procedure involved, and the interpretation of its results. The purpose of ECG. ECG is primarily used to detect and diagnose various heart conditions, such as arrhythmias, heart attacks, and abnormalities in the heart structure or function. It helps healthcare professionals assess the heart's rhythm, identify any conduction abnormalities, and monitor the effects of medication or treatments on the heart. The ECG procedure. During an ECG, electrodes are attached to specific locations on the patient's skin, typically on the chest, arms, and legs. These electrodes detect the electrical signals produced by the heart as it beats. The signals are then transmitted to the ECG machine, which records and displays them as a series of waves on a graph. Interpreting ECG results. The ECG recording consists of several waves and intervals, each reflecting a different phase of the heart's electrical activity. The P wave represents the atrial contraction, the QRS complex signifies the ventricular activation, and the T wave represents the ventricular repolarization. Variations in these waves and intervals can indicate potential abnormalities. Common ECG abnormalities. There are several common ECG abnormalities that healthcare professionals look for during interpretation. These include 1. Arrhythmias, irregularities in the heart's rhythm, such as tachycardia, fast heart rate, or bradycardia, slow heart rate, can be identified through ECG. 2. Myocardial infarction. ECG can detect changes in the ST segment, which may indicate a heart attack or myocardial infarction. 3. Ischemia. If there is insufficient blood flow to the heart muscle, it can manifest as ST segment depression or T wave inversion on the ECG, suggesting myocardial ischemia. 4. Conduction abnormalities. ECG can identify abnormalities in the heart's conduction system, such as bundle branch blocks or atrioventricular AV block, which can affect the heart's rhythm. 5. Hypertrophy. ECG can help determine if the heart's chambers are enlarged, indicating left ventricular hypertrophy or right ventricular hypertrophy. Clinical application and significance. ECG is a valuable tool in diagnosing and monitoring various cardiac conditions. It aids healthcare professionals in making accurate diagnoses, assessing treatment effectiveness, and determining the need for further interventions. ECGs are commonly used in emergency settings, routine checkups, preoperative evaluations, and cardiac disease management. Limitations and considerations. While ECG is a powerful diagnostic tool, it does have limitations. ECG is a snapshot of the heart's electrical activity at a specific moment, and abnormalities may not always be present during the recording. Some conditions, such as intermittent arrhythmias, may require additional monitoring methods, such as Holter monitoring or event recorders. Conclusion. Electrocardiography, ECG, is an essential diagnostic test that provides invaluable information about the heart's electrical activity. By interpreting the waves and intervals on the ECG recording, healthcare professionals can detect and diagnose various heart conditions. ECGs are instrumental in guiding treatment decisions, monitoring progress, and improving patient outcomes. Understanding the purpose, procedure, and interpretation of ECG tests allows individuals to appreciate the significance of this invaluable tool in cardiovascular healthcare.